There is a lot of controversy about PSA screening and when to start. The current guidelines are to screen any man who has a 10-year or more expected survival, who's between the ages of 55 and 70, but to also have the discussion of prostate cancer screening with any man who has a greater than 10-year expected survival. We begin that discussion with most men starting at age 40 and offer the opportunity to undergo PSA screening if they're either concerned about the risk of prostate cancer or have a strong family history of prostate cancer. Any man who has a first-degree relative, father, grandfather, uncle with prostate cancer has a higher risk of developing prostate cancer.
Well, the recommendation is first PSA at 50. Unless you're African American, you should get it at 40. And if you've got a family history, it should be 40. But typically, I usually recommend even before 50 getting a PSA to get a baseline. If it's very low, then it can be, put off for a few years. But the main thing about PSA is not just what the level is, but the changes in the level. The changes of the level are far more accurate in determining who has cancer than not, because you can have a normal PSA and still have prostate cancer. So I encourage people to get it as early as possible. We may not do a biopsy on you if we think it's not exactly where we want it to be, but we like to see trends. So getting them even if you're, if you're 40 would be, I think, reasonable.